The impact of Medicaid cuts on our elders. Asterisk asterisk cutting Medicaid, a betrayal of our elders asterisk asterisk. Imagine a world where the very safety net that supports our aging loved ones is ripped away. This is not just a hypothetical scenario, it's a reality that many families are facing today. As a physician in Nevada, with over 25 years of experience caring for older adults in both hospice and emergency settings, I have witnessed firsthand the precariousness of the support systems for those who have dedicated their lives to work and now require assistance with everyday tasks. Caring for an elderly parent or spouse is an emotionally and financially taxing journey. The last thing families need is for lawmakers to strip away the one program that ensures their loved ones can remain safe at home, or that covers the costs of nursing home care. Unfortunately, this is precisely what has transpired with the recent legislation passed by Republicans in Congress. Signed into law by President Trump on July 4, this new law slashes over $1 trillion from Medicaid and Affordable Care Act funding to provide yet another round of tax cuts for the wealthiest individuals. In my professional opinion, this is the most detrimental legislation for seniors that I have encountered throughout my career, and its repercussions will be profoundly felt here in Nevada. Medicaid serves as the primary source of funding for long-term care in the United States. In Nevada alone, it supports 60% of nursing home residents and finances home and community-based services that enable 17,600 Nevadans to receive care at home rather than in institutions. Approximately 90,000 low-income seniors in our state rely on Medicaid to help cover expenses that Medicare does not, such as 24/7 supervision, assistance with daily activities like bathing and meal preparation, prescription medications, and facility fees that can easily exceed $100,000 annually. This is why the new law proposed by the GOP is so alarming. It threatens to strain state Medicaid budgets by cutting hospital funding and imposing harsh work requirements. With diminished resources, states will be compelled to reduce care for seniors and other high-cost services, making it increasingly difficult to meet the needs of all patients. As a former emergency physician now focused on hospice care for our most vulnerable patients, I harbor significant concerns for the future of our aging population. Daily, I observe dedicated families striving to care for their elderly loved ones. For instance, consider a wife in her later years who is caring for her husband suffering from advanced Alzheimer's disease. She is immensely grateful for the 4 hours of daily personal care assistance funded by Medicaid, which allows her the time to manage her own health appointments and grocery shopping. Now, she is filled with dread at the prospect of losing that vital support, facing an agonizing decision: neglect her own health, deplete their savings, or place her husband in an unaffordable institution. Ironically, the nonpartisan Congressional Budget Office has projected that this law will not yield savings. Instead, it is expected to add nearly $4 trillion to the federal deficit. In summary, the GOP has chosen to dismantle elder care, remove health coverage from Nevadans, and simultaneously increase the national debt. This represents both fiscal irresponsibility and a moral failure, all wrapped up in a bill that primarily benefits billionaires. Senator Catherine Cortez Masto raised concerns months ago, alerting us that sweeping cuts to Medicaid would strip essential support from 1 in 6 Nevadans, including children, mothers, and seniors. She has demonstrated that bipartisan solutions are possible, collaborating with Republican Senator Bill Cassidy to enhance dementia care, and advocate for increased federal investment in long-term support. We should take inspiration from such examples rather than dismantle the very programs that facilitate this crucial care. My patients are not just numbers, they are parents, grandparents, and community leaders who have nurtured us, educated us, and held our communities together. They deserve to age with dignity. Reducing Medicaid funding to enrich the wealthiest Americans is not merely poor policy, it is a profound betrayal. Dr. Nita Schwartz is a specialist in palliative care and hospice medicine based in Carson Valley. GOP Health Care Overhaul: What Nevada residents need to know after one big beautiful bill. Imagine a seismic shift in healthcare policy that could reshape the landscape as profoundly as the Affordable Care Act did a decade ago. The recently passed GOP bill, often referred to as the One Big Beautiful Bill Act, is poised to be the biggest health care shakeup since Obamacare was enacted in 2010. This legislation could significantly impact Nevada, potentially driving up the state's uninsured rate and altering how residents access healthcare. While some portions of the bill won't affect Nevadans until several years from now, experts are already warning of far-reaching consequences. The ACA was a game-changer for Nevada, reducing the uninsured rate from a staggering 22% in 2012 to just 8% today. However, the new bill introduces sweeping changes that could undo much of that progress. Proponents argue that the bill aims to curb waste and abuse in the health care system, but it includes nearly $1 trillion in federal health care cuts over 9 years, with more than $930 billion coming from Medicaid. These cuts are likely to vary by state, depending on each state's ability to offset reductions or delay certain policies, such as work requirements. According to Drew Altman, CEO of the independent health policy organization KFF, some states might find ways to mitigate these impacts, either by replacing lost funds or slowing down the implementation of work requirements. However, he also notes that the expiration of enhanced subsidies for marketplace insurance could exacerbate the situation, potentially causing premiums to skyrocket by up to 75% in 2026 if they aren't renewed. In Nevada, where Medicaid covers 1 in 4 residents, the projected cuts amount to a modest $60 million over the next 5 years, which is a small fraction of the state's overall Medicaid budget of over $15 billion for the next 2 years. Despite this, it's estimated that approximately 100,000 Nevadans, about 12.5% of Medicaid enrollees, could lose coverage in the first 2 years after the work requirements are implemented in 2027, or 2 years later if the state secures a waiver. The bill introduces several new bureaucratic hurdles, such as increased documentation requirements and the end of automatic renewals for marketplace plans. Premium subsidies will now be withheld until eligibility is confirmed, forcing applicants to pay up front before receiving assistance. Additionally, the open enrollment period is shortened to just 1 month from the previous 2-month window. Perhaps one of the most contentious provisions is the exclusion of lawfully present immigrants, including DACA recipients, those with temporary protected status, and asylum seekers, from accessing insurance through the marketplace. This move has sparked debate about the fairness and inclusivity of the bill. Jennifer Krupp, a spokesperson for the Nevada Health Authority, acknowledges that some coverage losses are anticipated but emphasizes that it's too early to gauge the full impact of the expiring enhanced subsidies. The state plans to introduce a public health insurance option with reduced premiums and a reinsurance program in 2026, both aimed at mitigating the loss of federal support. Many health care experts predict that the effects of the bill will unfold gradually over the next decade. John Packham, Associate Dean for Statewide Initiatives at the University of Nevada, Reno School of Medicine, suggests that while the immediate impact might not be severe, the long-term consequences could be significant. He warns that the state will eventually need to address the shortfall in federal funding. One of the most controversial aspects of the bill is the introduction of work requirements for Medicaid beneficiaries. Starting in 2027, eligible individuals must prove they are working, volunteering, or attending school for at least 80 hours a month. Exemptions apply to pregnant women, individuals with disabilities, and parents of children under 13. Approximately 66% of Nevada's Medicaid enrollees are already employed, so the impact is expected to be substantial. Larry Levitt, Executive Vice President for Health Policy at KFF, highlights that while the work requirement provision saves the federal government the most money, millions are expected to lose coverage due to difficulties navigating the new eligibility process. This could lead to increased reliance on emergency rooms, higher costs for health care providers, and ultimately, higher premiums for private payers. Another contentious issue is the introduction of copays for Medicaid recipients earning above the federal poverty level. Under the new bill, these individuals could face a $35 copay per service, up from the current low or no-cost sharing arrangement. Experts like ASM. David Orentlicher worry that this could deter people from seeking preventive care, leading to worse health outcomes and higher hospitalization rates. Community health centers, which serve the most vulnerable populations, are also concerned about the bill's impact. Sharon Chamberlain, CEO of Northern Nevada Hospice, estimates that more than 60% of her center's Medicaid patients could lose coverage, resulting in a loss of over $34 million. She argues that these closures would disproportionately affect low-income individuals who rely on these centers for essential health care services. Hospitals are also bracing for reduced provider tax payments, a practice commonly used to fund Medicaid patient care. In Nevada, this could mean a decrease of $600 million to $800 million over the next 5 years, potentially disrupting ongoing initiatives like the overhaul of the state's children's behavioral health system. Despite these challenges, some experts believe that Nevada might be better positioned to weather these changes due to recent health care reforms. The implementation of the Nevada Health Authority, the public health insurance option, and the reinsurance program could help mitigate the impact of federal cuts. As the effects of this bill continue to unfold, it remains to be seen how Nevada will adapt. The coming years will be crucial in determining whether these changes will truly represent a step backward in health care access and quality, or if the state can find innovative solutions to preserve its gains under the ACA. So, what do you think? Is the GOP bill a necessary reform or a step back for health care in Nevada? Share your thoughts in the comments.